Peace, mercy and blessings of God be upon you. How are you doing? I hope you are fine. Before we start anything, pray to the prophet. After we prayed to the prophet, welcome to the Megamind today, God willing, is the first episode in a series of an exploration journey inside the human body. Learn about the skeletal system, its function and its sub-organs. List of bones in the human skeleton and the muscles of the human body consists of 1_human skeleton, 2_joints, 3_laces, 4_muscular system, 5_tendons. The primary functions of the musculoskeletal system include supporting the body, enabling movement, and protecting vital organs. The bony part of the system functions as the main storage system for calcium and phosphorus and contains the essential elements of the hematopoietic system. This system describes how bones and muscle fibers are connected to each other by connective tissues such as tendons and ligaments. Bones give stability to the body. Muscles keep the bones in place and also play a role in their movement. To allow movement, the different bones are connected by joints. Cartilage prevents direct friction between the ends of the bones and each other. Muscles contract to move the bones attached to the joints. There are sub-devices. 1_the skeleton, 2_muscular system. There are diseases and disorders that may adversely affect the function and effectiveness of the system. These diseases can be difficult to diagnose due to the close relationship between the musculoskeletal system and the body's internal systems. Complex injuries of the musculoskeletal system are usually dealt with by a physiatrist, a specialist in physical medicine and rehabilitation, or an orthopedic surgeon. The most important diseases of the musculoskeletal system: osteoporosis, bone fracture, lateral deviation of the spine, osteomalacia, lordosis. Now I will talk about osteoporosis. What is it, its causes and the way to protect from it, and we will continue with each other, God willing. In the next episode, the rest of the diseases. What is osteoporosis? Think about this for a while. What is this disease and why did I call it this name? It is a rheumatic disease caused by a decrease in bone density or thinning in the skeleton. It is a condition that affects half of women and a third of men over the age of 70. Which is accompanied by severe pain, and makes them vulnerable to fractures. And we knew what he was, but someone knew his name like this. Why did I want to know from you in the comments? There are several factors that may increase the risk of osteoporosis, including sex or gender, menopause, testosterone deficiency, age, family history, skeletal structure, tobacco consumption, estrogen level, medicines from the group of corticosteroids, taking these medications for long periods of time, such as taking prednisone or cortisone, causes damage to bone tissue, and it is known that the use of these drugs is common in the treatment of some chronic diseases, such as asthma, rheumatoid arthritis, and psoriasis. Thyroid hormone selective serotonin reuptake inhibitors, SSRIs. Other medicines. Continuous and prolonged use of these medications may affect bone health, including the following: heparin, a blood-thinning drug, and its prolonged and continuous use. Methotrexate, an anti-tumor drug. Some medicines to treat seizures. Many diuretic drugs. Antacid medicines that contain aluminum. Breast cancer, calcium deficiency, medical conditions and procedures that reduce calcium absorption, a lifestyle without physical activity, excessive consumption of soft drinks, alcoholic, depression. Prevention of osteoporosis. Some of the tips listed here may improve the prevention of bone mass loss. Maintaining physical activity. Add soy products to your daily food menu. Stop smoking. Examination of the possibility of receiving hormonal treatments. Refrain from consuming excessive alcoholic beverages. Consume adequate amounts of calcium. Reducing caffeine consumption. Consuming adequate amounts of vitamin D, but after consulting a doctor. We finished today's episode and, God willing, we will complete the next episode on the rest of the diseases, as I said before. Oh. You are at a very expensive timepiece. Mercy and blessings of God, and I have a new meeting next Tuesday, God willing.